Thinking about an arm lift? Let's talk about it. People who have had massive weight loss know this. People who have just managed to live and are grown know this too, and that is, as we have drastic life changes, one of the things that can happen is that you have sagging of the arms. I can't see my arms now, but you know what I mean. And that can be a cosmetic issue, but it can also be something that's just really uncomfortable. Chafing, rashes, it affects how you move, how you live, how you dress even. We change the dresses that we pick because we don't want to show our arms. It can affect us in a multitude of ways. And so arm lift surgery is actually a great surgery for people who have experienced any number of these symptoms. But what is it actually? What happens in an arm lift? What can you expect afterwards? I will break that down in this video. So again, let's talk about the why before we get into the what. Sagging arms is an issue, and it's not an issue that unfortunately can be fixed with just doing a bunch of bicep curls or tricep curls or what have you in the gym. It actually is loose skin that will not just snap back. And we see this again with mainly people who have lost tons and tons of weight, or people who have just aged and so have kind of loss of elasticity in their skin and so sagging skin. When you go for a consultation for an arm lift, the surgeon will obviously assess you, but the key things to remember are, one, where the incision will go, whether you need a mini lift versus a full lift. In terms of the what, so the key things about arm lift are that there are various different kinds of arm lift. Some truths are universal. So one truth is that the scar is going to be a trade-off for the sagging skin. And that's usually true in all of plastic surgery. We create scars to address things, and so you have to be okay with the scar to be able to get that thing addressed. That being said, you want the scar to look great. Obviously, you don't want a bad scar. But in arm lift surgery, one of the risks is as a wide noticeable scar. Where is the scar? So typically the incision is typically in that bicipital groove on the inside of the arm. If you're having a mini arm lift, that incision can actually be in your axilla or your armpit. But it depends on how much sagging you actually have and also the direction of that sagging. Is it vertical sagging, or do you kind of have more bat wing action that needs to be addressed too? That's also a question. And then having sagging skin for many people is not the only issue. The other issue is that they also have some excess fat there that they want to address as well. And so in that case, surgeons will usually recommend brachioplasty that includes liposuction. So removing any excess fat and then after that removing excess skin. And in some cases, you actually may not be a great candidate for brachioplasty necessarily in the true way where you're actually removing excess skin, but you may just be a candidate for liposuction to address any excess fat, and the thought is that your skin is so healthy and so elastic that it will indeed snap back and you'll have the result that you want. A good consultation would not be a good one without discussing the proper risks of surgery. So what are the risks of brachioplasty? So again, the biggest one is the scar is usually the full length of the upper arm. It's a place where you can have some tension from how much you're trying to really tighten the arm, and so that you can end up with a scar that is wide. Again, hypertrophic scarring is not foreign to this part of the body either. And especially in darker folks, having a hyperpigmented wide scar can very much be a thing after brachioplasty. Another thing that we can see that's a bigger risk of this surgery is numbness. There is a pretty big nerve that runs in that area that supplies the sensation to the inner arm. If this nerve gets damaged, it could mean temporary versus permanent loss of sensation or decreased sensation, or maybe even hypersensitivity in that area, which it sounds like it could be really annoying. It does not affect the function of the arm, however, so that's not a concern. But changes in sensation could be a major concern. Other things that we can see with really any surgery: problems with wound healing, problems with infection, having a fluid collection. These are all things that are possible. They're lower risk, especially when done well and when certain precautions are taken, but possible. What does normal recovery look like? So the number one question I have when I think about a normal recovery from a brachioplasty is, can you wipe your own ass? And the answer is maybe not, right? So normal recovery is actually quite painful. We're doing both arms at the same time. So that means you're pretty debilitated for those first few days because pain can be an issue. Typically, you can expect also to have drains in place. I know I put drains in for every brachioplasty that I do. And then the other thing is you're gonna have compression on to help with the swelling. So both of those things combined can make you feel like you're walking a little funny and your arms are heavy and a little bit or a lot uncomfortable. The first week of any surgery is usually the worst, and that's where I would say in this case it probably is worse because you can have some limited ability to really do things that you would normally do for yourself, like feed yourself, wipe your own ass, things of that nature. So think about, again, having a strong team that's going to be helping you this week, a team that's willing to brush your teeth, a team that's willing to really love you, wash your face, help you put on shirts. Think about not having shirts that require you to lift your arms and put your arms through the armholes, but rather ones that button up in the front, or just ones that are like shawls really and just have no sleeves and you don't have to worry about anything. Sleeping after surgery, immediately after surgery, is always awkward. In this case, I would recommend that you elevate your arms on pillows so that way that helps with the swelling afterwards. That's usually the first week where things are the toughest, and that's true of really any surgery that we do. Week 2 is probably a little bit better. Most people get their drains out at this time if they have them. I always advise my patients that even after the drains come out, and actually especially after the drains come out, it's even more important to continue compression because you want any potential space that the body has that usually fills with fluid, so you want to decrease any of that potential space by compressing all of that tissue. And then around week 2 is when we begin discussing scar care to maximize the beauty of that scar. I've discussed scar care in other videos, but just to break it down quickly, in this one, you want to make sure that you moisturize, you keep away from the sun, and that you massage. So you can use things like silicone sheets, which are really easy to apply. You can just use Vaseline or Aquaphor, which I love the most. And then obviously making sure to massage frequently to help with breaking up scar tissue and making that scar as nice as possible for you. Major restrictions after surgery are especially true here. So 1, no heavy lifting, more than 10 pounds at the very least. And then obviously no exercise. And typically we continue these restrictions for at least 6 weeks. I don't have any particular restrictions about how you move your arms. You can move your arms in however comfortable position that you want to. I do encourage my patients to bathe the day after surgery. So I want you to get incisions wet. I want you to keep them clean. And we really want to find that fine line between babying yourself and not overdoing it. The other thing I didn't mention earlier is that asymmetry is always possible whenever we're doing 2 sides of anything. So that could be possible that you have a little bit more on one side than the other, residual skin or residual fat, and those things can be addressed in revisions if needed. But typically scar revisions are typically not done before 6 months. And ideally would be done at around a year, closer to a year. Some residual questions that you may have that I haven't already answered. How bad are the scars really? I will give you my honest opinion. I think in terms of all the kinds of scars that we make for all the different procedures that we as plastic surgeons do, brachioplasty scars tend to be the worst because they tend to be wide. And even when you take care of them really well, they're always going to be pretty noticeable. But again, you're trading the scar for the sagging skin that you have. So you have to be okay with that trade-off because the scar is pretty significant. Even if you do the best scar care ever, I think it's still a pretty significant scar compared to everything else that we do. And it's not something that you can hide in the bikini line or in a bra. It really is apparent whenever you wear a short sleeve, no sleeve shirt. So something that you have to be okay with. And then the other question is, do the results really last? Yes, and this is true for most plastic surgeries, is that as long as you don't have drastic changes in your health, in your weight especially, then these results should really last you up to a lifetime. Are you thinking about armless surgery? Please, if you have any questions, leave them below. Leave your comments below as well. Please like and subscribe. And as always, love you lots and bye for now.